We all understand that picky eating is a common problem in children, but we also know that it's usually a temporary and normal part of development. It's common for toddlers to eat only very small amounts, to be fussy about what they eat, and to refuse to eat at all. Toddler appetites vary constantly because of growth spurts and variations in activity. Toddlers aren't growing as fast as babies, so they need less food. Most children outgrow this as they grow up. For children with sensory processing disorder, food poses trauma as they are picky eaters, rarely eat the same kind of meal as the rest of the family, do not want to touch food, and may have aversions to tastes, textures, and refusal of food due to odors. Tactile refers to the sense of touch, and tactile difficulty or sensitivity is a form of sensory processing disorder that causes the sense of touch to become uncomfortable to the extent of pain in children. Welcome to Discover Momentum. Remember, this is your support group. What can appear perfectly normal to the parents can be extremely uncomfortable for the child experiencing tactile sensitivity. Shoes may feel painful or tight. Clothes that look perfectly fine and good may appear scratchy. The child may feel either extremely cold or hot in perfectly normal temperature. And the most significant of tactile difficulty may be refusal to have a haircut or cut their nails, combing hair, and brushing teeth can be an agonizing ritual. Mouth or oral cavity experiences certain sensations more strongly than the other. It's important to note that children who have tactile difficulty are not just being difficult or picky eaters. These sensations on their skin are very real. The tongue in particular has a lot of tactile receptors to give feedback on the way food feels or how hot or cold it is. Inputs are received orally when anything touches the lips, tongue, gums, and cheek. The tongue has tons of receptors that allow it to taste various flavors such as sweet, salty, sour, and spicy. The jaws provide deep pressure input called as proprioception. Chewing and sucking gives input to this sensory system. So a child who is experiencing high or low oral sensitivity often gags at the taste or sight of certain textures to the extent of throwing up, dislikes brushing teeth, and prefers specific texture of foods, either that is too crunchy or soft, and swallows it mostly to avoid the food touching the other areas of the mouth. They may also love bland food or food with absolutely no flavor. Some telltale signs of oral sensory disorder can be seen in the child, either biting toys or people, especially when unprovoked or when overly excited, licking of various items or random objects or even nails, frequent chewing of objects like wood, paper, crayons, pencil, or sucking their lips and biting lip quite frequently. Due to this difficulty and selective eating, the nutritional requirement of the child may be affected, resulting in deficits and craving, and in turn affecting the child's development, weight, stamina, and eventually behavior. One must bear in mind that the nutritional needs of the sensory difficult child must be compensated through patience and added sources of healthy nutrition. This does not mean feeding milk or sweets or only ice cream. Managing the nutrition of children is not only essential but extremely important, and this is even more crucial for a child with sensory processing disorder. Some support towards this can be in the form of using edible tooth powder instead of toothbrush that can help massage the gums, lips, and mouth, desensitizing the child's oral sensitivity. Avoid junk food as much as possible. If the child craves for crispy food, make sure that vegetables are mashed in a mixer and added to the batter that in turn can be turned into crispy food. Get a food allergy test done as quickly as possible and eliminate the allergic foods from the child's diet. Check for lactose intolerance or gluten intolerance. Lactose is the milk and dairy products, and gluten is usually found in meat. Make sure a sensory diet plan is created for the child so there are lesser power struggles. Sensory processing will affect digestion. Constipation or loose motion are the two extremes. Since the child may not be able to recognize thirst, hunger, and a feeling of full stomach, make sure you follow a proper dietary pattern and routine. Remember that oral motor difficulty is because of tactile, that is, touch and motor difficulties. This affects toileting issues of the child. The child may find it difficult to recognize sensations of urination or passing of stools. Toilet training may be longer than expected. Be patient and consistent. Remember that plenty of water, fiber in food, and activity throughout the day will ease these to a very large extent. Please note that children with sensory processing disorder have behavior difficulties, but remember that all children with behavior difficulties need not have sensory processing disorder.